with you also being nicknamed, whether you know this or not, the Dr. Fauci of Alabama.
I did not know that. Hey there.
Hi.
Hi. Thank you so much, Dr. Harris, for being with us today in our second installment of Pizza and Politics. We really appreciate you taking your time out of your busy schedule and with all of the winter weather that we're experiencing to come and speak with us today. For this interview today, we'll just have some icebreaker questions to get to know you a little bit more. Then some preliminary questions to get to know your role as state health officer, and then some more in-depth questions about the COVID-19 response from your perspective.
Okay, absolutely.
Thank you. So we're going to start off with our first icebreaker. Because this is technically Pizza and Politics, we want to know, what is your go-to pizza order?
It's always pepperoni. It always is.
Me too. I feel like if you can have the option to put the meat on it, you should go ahead and do
it. That's right. I've never had one that didn't have it, I don't believe so.
Well, thank you for those responses, and we're going to hand it over to Amaria to ask our first preliminary question.
Okay.
Well, hi. Thank you so much for being with us once again, Dr. Harris. Our first preliminary question for you is, why did you decide to pursue the specialties of infectious diseases and public health?
As I mentioned earlier, I wanted to be a physician, and I guess I really didn't know for sure what it was I wanted to do. But when I was in medical school, actually, when I was a first-year student, in fact, I did a course that was a infectious disease microbiology kind of course. And I just thought it was the most interesting thing I ever had studied. I don't know why, really, but the professors who taught that course were people that I just really thought a lot of and respected, and they gave me encouragement, I guess, to pursue it. And so that's why I really wanted to go into that specialty. But when you do infectious disease, actually, you really end up treating a lot of disadvantaged people. Infections are things that sort of disproportionately affect certain groups of people, but not necessarily other groups. You think they would be spread evenly among the population, but that's actually not true. And so I think I just gradually came to be aware of how important social determinants are in determining what people's health outcomes are. You know, there are just a lot of things, a lot of situations that you're born into that you have no control over, that really determine the trajectory of your health, you know. And it can be, you know, your parents' education level, it can be your zip code you're born into, it can be, you know, how much money, you know, the household makes. All those kind of factors that really have nothing to do with you as a person actually have a lot of impact on what happens to you health-wise over time. And so being an infectious disease, I guess I gradually came to learn that. And that's why I wanted to go into public health.
Okay, thank you so much for answering those questions for me. I'll pass it over to my co-chapter leader, Jeremiah Lother.
Good afternoon, Dr. Harris. My question for you is, what are the responsibilities of a state health officer?
Well, so my job is like I guess you'd say, the chief executive of the organization. You know, on one sense, it's a big sort of bureaucratic government agency, and we have a lot of we have a lot of employees. We have people working in every county in the state, and we have a lot of responsibilities to regulate things that we're required by law to do. Like we go and inspect restaurants, or we investigate outbreaks of diseases, or we follow up if there are animal bites. You know, that goes to the health department. We help people that are building septic tanks. You know, like if you live in a rural area and you don't have access to sewage like you would in a city, you have to have a septic tank. And so there's all these legal responsibilities that we have. And so in one sense, my job is just being the guy that, you know, has to handle the payroll and the budget and the hiring and firing and just sort of running that organization. But really the interesting part, the part I really like, is actually just being a public health physician and trying to guide the agency in terms of what do we want to prioritize, what problems do we have in our state, you know, how do we address you know, the lung associated vaping problem, you know, how do we address Zika outbreaks, How do we, now deal with COVID? And so there's always public health issues that come up. Alabama being the state we are, we have a lot of chronic disease already. I mean, even before COVID, we're at or near the bottom in things like rates of diabetes and rates of heart disease and cervical cancer and infant mortality. We have a lot of problems that, in which we wouldn't rank that well even in the developing world, much less in the United States. So I really enjoy the idea of just trying to develop policy about how our state should respond to those kind of things.
So, with Alabama health conditions varying greatly throughout the state, for example, within urban and rural areas, how has your decision making during COVID-19 been recognized within these different areas, and how can it be still seen?
It's really been a challenge because I think the whole country as a whole in a lot of ways has just been divided over every possible issue. Certainly politically, coming through this campaign, you just see that people just aren't on the same planet in a lot of ways.
Mhm.
But even when you're not talking about politics, if you're not talking about a political party or whatever, there's also been for a long time a huge urban and rural divide in this country, and it's clearly in Alabama too. Maybe not as much here as some places, but there's a huge urban rural divide. People just think differently. People have different values, not saying one's better or worse or anything. It's just people are different and they have different needs. They have different access to resources. They make different decisions and different choices. If you're in a big metropolitan area in this country, you live there and work there and go to school there, probably you have a lot more in common with 30 other big metropolitan areas in the country than you have in common with the people that live 20 miles away from your city out in the countryside. I mean, people that live in cities just have a lot of things in common. People that live in rural areas have a lot of things in common. So I say that to say that it's hard to come up with policy that works well in all areas. If you live in a rural area in Alabama, you're much more likely to not have health insurance. You're much more likely to be an older person on average than a younger person. You're much more likely to not live very close to a hospital. You're much more likely to have chronic health problems, like all those things that we think about in Alabama, but they're much more common in rural areas than they are in urban areas. And so it's a real challenge to come up with a one size fits all kind of solution, when you're trying to take care of groups that are really, really different.
All right, thank you. And then my next question is, in a recent message on the Alabama Public Health website, you acknowledged the distrust minorities may harbor towards public health initiatives. You stated that your department is collaborating with leaders in minority communities to reestablish the trust. Has your department been able to monitor and evaluate the outcomes of these efforts?
Yeah, I would say that we're not sure yet, but clearly there's definitely I think I was speaking, if I remember what you're talking about, with respect to vaccine hesitancy. I think that's what we were talking about. Why are some communities more interested in taking the vaccine than other communities? And I think the first thing I would say is there's a lot of when people don't take the vaccine, there's a whole lot of different reasons for that. And, there's a lot of different reasons that people may have hesitancy, but there are plenty of people who just want the vaccine and can't get to it right now as well. And so it's kind of hard to know sometimes when you're seeing what your uptake is, what are the reasons we're not reaching everybody we want to see. So we're trying very hard to prioritize vaccination of the African American community because those are the folks that are disproportionately dying from this disease. I mean, not in sheer numbers, but just statistically, they're more likely to be the ones who get the most sick and then to not survive. And the reason for that is, I think, is because African Americans disproportionately have more of those chronic health problems that make it likely for you to get sick and die. There's more diabetes and heart disease and all those issues in the African American community. So I was going to try to tell you exactly, but in the past 6 weeks or so, we've been 6 or 7 weeks, we've been doing shots. About a little over 11% of our vaccines has gone to African Americans in our state. But there's about a third of people we don't have any data for, and there's a long technical explanation for why we're not capturing that. But what I would say is we know 11% is not enough. It may be higher if we had all the data, but compared to the U.S. as a whole, I think right now vaccine recipients in the United States as a whole are only about 5% African American. So we're doing a little better than the national average, but we're not doing anywhere near as good as we should be. In African American, Black Alabamians are about 25%, 26% of the population. So we got a long way to go to be equitable in doing that. But to try to answer your question, monitoring it is really hard. When we put vaccine in a predominantly African American community, in a county health department or in a community health center, if people aren't coming to get it, we're not always sure why that is. Maybe they don't want to take it and they don't want any part of it, but maybe they just don't have a rod.
My question is, the politicization of public health recommendations, such as wearing a mask and social distancing, has compounded the difficulty of managing this pandemic. So how has this awareness of this issue guided how you inform Alabamians of this about the pandemic?
Well, that's a great question. I would say, first of all, I never saw that coming. You're exactly right. It is heavily politicized, and that never occurred to me that was ever going to be the case. However, I have since read fairly recently a book on the 1918 Spanish Flu Epidemic, the 1918-1919 flu pandemic. And exactly the same thing happened then, in this country. Exactly the same thing. Public health people said, wear a mask. It's a lot harder to transmit the flu if you do. And people were just outraged. But some people trust government a little better, and some people trust the government, to have solutions to try to fix things. And some people absolutely don't. And so you just have to remember that these things can get politicized even when there's no reason that they should be. Wearing a mask, it's just so simple. It's like this simple, and it doesn't hurt, and it doesn't cost much, and no harm, no foul. But some people just can't stand to be told what to do.
All right, so my question is, what inequalities has COVID-19 exposed in Alabama's healthcare system, and what are some possible solutions for these issues?
That's an easy one. No, I'm just kidding. That's the hardest question that anybody's asked. So I like the fact that you use the word, what inequalities has it exposed, because COVID-19 has not created a new inequality. It's just revealed the same inequality that we've always had and that we have for a whole lot of other things. It all comes back to what in public health we call this idea of social determinants. There are a lot of things that can determine what happens to your health, right? A big one is what your personal choices are. How much do you smoke? How much do you drink, or do you drive your car really, really fast? Clearly there's a lot of personal choices that determine your health risk. There's genetic factors. You're born with something that you inherited from your parents, can't do anything about it. But maybe you have cystic fibrosis, or maybe you're likely to develop cardiac disease because you inherited that. So those are certain types of determinants, your personal behavior determinants, your genetic determinants. There's also access to care that determines things. Do you have the ability to see a doctor or not? Do you have one in your community, or whatever? But the social determinants actually play the biggest role. Social determinants can predict your health more than all those other things put together. And so that is, what's your race, what's your zip code, how far did your parents go in school, how much income is coming into your family. And you don't really have any control over any of that. You were just born one day and all those, situations were put into place. And so that's the real, the real health disparity that COVID is revealing once again, just like we see it with all those conditions I mentioned a little while ago.
Thank you so much once again for joining us here today, Dr. Scott Harris. We really do appreciate you for taking your time out of your day. And
keep it up.
Thank you so much. For people who will be viewing this episode, how might people be able to either contact you or contact the Alabama Public Safety?
Yeah, if you have questions for me, you're welcome to email me the way that you emailed me originally. You can contact me that way. We'll do our best to answer them as quickly as possible. I can tell you, it's not always as fast as you would like. We really, I literally get, several hundred emails a day, every day, and eventually I do look at them, but I'm always a little bit behind. But if there's specific questions that we can answer, I'll be glad to do those. And in some cases, there may be folks in the organization who can answer them better than me, and I'll pass them to somebody else. But feel free to send.
All right, and I believe that concludes our second episode of Pizza and Politics. Thank you so much once again, Dr. Harris.
Okay, thanks, guys. Thank you for having me. Take care.
Thank you.
Bye.